Look, if you've been searching for treatments for a bad knee, you have no doubt seen the ads. The ones promising miracle cures in exotic locations. Well, today, we are stripping away all that marketing hype. We are going to help you navigate the highly complex and honestly, sometimes really confusing landscape of knee stem cell therapy in Thailand. We're relying strictly on the absolute latest evidence to give you the clear, hard facts you need before you make any major medical or financial decisions.
Okay, here is our roadmap for today. We're covering the stem cell promise, what the evidence says, are you a candidate, the cost in Thailand, and finally, how to choose a clinic. Let's get right into it.
Part 1. The Stem Cell Promise. We've got to start by acknowledging the dream that brings so many international medical tourists to Thailand in the first place. The single most common question patients ask is simply, can stem cells regrow my knee cartilage? And it's a captivating idea, right? Repairing a failing joint instead of just managing its inevitable decline. But we need to quickly pivot our focus away from this idea of structural cartilage regeneration and look at what these treatments actually achieve clinically. Because, well, that is where the real science lives.
There's a crucial distinction we have to make here. On one hand, we've got symptom improvement, things like feeling less pain, walking farther, or finally climbing those stairs comfortably. On the other hand, we have true structural cartilage regeneration, literally rebuilding a brand new durable layer of normal cartilage. Now here's the kicker. You can achieve very meaningful symptom relief, like getting back to your favorite sports, without the treatment successfully regrowing your thinned out cartilage. Feeling better is clinically huge, for sure, but it just shouldn't automatically be sold to you as proof that lost cartilage has magically grown back.
Part 2. What the evidence actually says. Let's look at the science, drawing on the absolute latest 2025 and 2026 research. Trying to figure out if stem cells work right now is kind of like trying to figure out if exercise works by clumping weightlifting, swimming, sprinting, and yoga all into one giant category. It doesn't make sense. A 2026 meta-analysis of 24 trials involving over 1,300 patients showed wildly high heterogeneity. Why? Because clinics are using vastly different cell sources, things like ADSCs, SVF, or BMAC, at completely different doses. It is definitely not one single standardized treatment.
Now, a 2025 Cochrane Living Systematic Review looked at over 1,300 people across 25 different trials. At 6 months, compared to a placebo, pain was about 1.2 points better on a 10-point scale. Function, about 14.2 points better on a 100-point scale. So those are modest, but very real improvements. But notice the certainty of evidence here. It's rated as low. Not because the treatment flat out doesn't work, but simply because there is no single standardized protocol yet. We just can't guarantee the exact same result for every single patient.
But here's why Thailand is such a major focal point right now. They aren't just selling medical tourism, they're actually contributing to the science. A 2025 multi-center study involving institutions like Suriname University of Technology Hospital looked at patients with early-stage osteoarthritis. They found that autologous adipocyte-derived cells showed favorable MRI, synovial, and functional outcomes when compared directly to standard hyaluronic acid injections. So we are seeing highly encouraging local research coming out of the country.
And here is the absolutely crucial takeaway. Science increasingly views these mesenchymal stem cells, or MSCs, not as literal building blocks that just stack up to replace lost tissue. Instead, think of them as biological signaling cells. They essentially act as chemical directors, influencing the joint microenvironment and modulating inflammatory pathways. Basically, they calm down the inflamed, toxic neighborhood inside your knee. This is a massive, game-changing shift in how we understand this therapy.
Part 3. Are you a candidate?
With that biology in mind, we need to figure out if you actually fall into the group of people most likely to benefit from a biological signaling treatment. An ideal candidate usually has early-stage KL grade 1 or 2 osteoarthritis. They still have relatively preserved joint structure and limited mechanical abnormalities. Now compare that to a complex candidate, someone with KL grade 4, severe joint space collapse, malalignment, or that dreaded bone-on-bone arthritis. If you're in that latter group, the evidence for stem cells gets a lot less convincing. Why? Because a biological injection simply cannot fix a structural mechanical collapse. It's like trying to fix a broken car axle with a software update.
And here is a number that might actually shock you. 63%. A 2025 review of 467 patients estimated that contextual and placebo effects could account for up to 63% of the observed pain improvement in MSC procedures. Think about it. When you travel abroad, pay for an expensive, highly sophisticated procedure,
Your expectations, the focused rehab, and the extensive physician interaction, they all play a massive role in how you end up feeling. This just highlights how incredibly vital it is to ground your expectations in reality.
Part 4. The cost in Thailand.
Okay, let's tackle the often confusing financial landscape. Publicly advertised prices in Thailand are drastically different depending on the extent of the treatment. A single knee procedure might start around 80,000 Thai baht, which is roughly $2,500 US. But bilateral procedures or large comprehensive regenerative programs, those can skyrocket up to 500,000 baht or about 15,000 US.
So what's driving that massive price gap? It really comes down to a few key variables. A cheaper quote might just be a simple, minimally processed injection of unexpanded cells. On the flip side, a higher quote might treat both knees and utilize highly cultured expanded cells from a top-tier lab. It might use specific cell sources like umbilical cord or bone marrow, include comprehensive MRI diagnostics, and weeks of extensive physical rehab. You literally cannot just compare the bottom line. You absolutely must compare apples to apples when you're looking at these clinic proposals.
Part 5. How to choose a clinic.
To make sure you aren't being taken advantage of, let's talk legality and regulation for a second. In 2026, the Thai FDA introduced a regulatory framework for advanced therapy medicinal products, or ATMPs. But here is the catch, and it's a big one. Just because a clinic says a treatment is available in Thailand does not automatically mean that exact product is actually Thai FDA registered. So instead of asking a vague question like, are stem cells legal, you have to ask under what specific clinical use pathway your exact proposed cell product is being administered.
So to vet a clinic properly, you need a checklist. First, ask exactly what biological product is being injected. I'm talking specific cell type, viable cell dose, and the passage number. Second, verify the laboratory manufacturing the cells and ask about their release testing, things like sterility and viability. Third, confirm exactly how your OA severity was diagnosed. And finally, demand evidence that supports that exact product. A credible clinic is going to have zero issue providing data for your specific cell type, whether that's MSCs or ADSCs. They won't just brush you off with glossy brochures and vague anti-aging promises. Ultimately, successfully navigating regenerative medicine in Thailand requires a complete mindset shift. It is not about finding a miracle cure, it's about finding the right, evidence-based biological match for your specific anatomy. So before you book that long flight and spend your hard-earned money, you have to ask yourself one final critical question. Does this specific biological product make biological and clinical sense from my exact knee, or are they just selling me a very expensive placebo?